How do I know when I should see a surgeon about hip or groin pain? This is a good question, and it's not that I would recommend running off to a surgeon anytime you have any pain in your hip or groin. But there are a couple of factors to consider in terms of when it's something that's likely to get better on its own versus when it's worth seeing a specialist. One, are there any mechanical symptoms? Do you feel like your hip locks, catches, or gets stuck? Second, how long has the pain been there? Hip pain or groin pain lasting over 3 months is not always, but is often a sign of an underlying structural problem. Third, was there an acute injury? This is an important one because if you know there was an acute injury and your symptoms aren't getting better, you may want to see a surgeon sooner rather than later in case whatever the injury is would benefit from early treatment. And finally, is this a recurring problem? I'm often seeing patients who talk about a history of hip flexor strains through athletics in high school or college. And often what was referred to as a hip flexor strain or a groin pull is really a symptom of an underlying structural problem. And so in summary, whenever you have had hip pain for an extended period of time, over 3 months, if you're getting mechanical symptoms like locking or catching, if there was an acute injury, or if the symptoms have been recurring, well, they're where they kind of wax and wane over time, these are all signs that it is a good idea to see a hip surgeon. And I just want to remind everyone that just because you're seeing a hip surgeon doesn't mean that you need surgery or that we would recommend surgery. When a patient comes to see me in my office, some of the things I think about in terms of their condition are, is this a problem that's likely to get better on its own? And if so, I usually like to let the body do its thing, sometimes with the assistance of physical therapy or possibly an injection. And is this a problem that is not likely to get better on its own? And if not, is it at risk of causing damage to the hip, which could lead to future problems for the patient? And if that's the case, then I will often engage the patient in a discussion about surgical treatment.